All right, let me share my screen. All right, can everyone see that?
Yes,
Perfect.
thank you.
All right, awesome. So, as Mike said, my name is Peggy Garcia. I'm the Director of Prevention Programming for the Appalachian Children Coalition. If you are unfamiliar with the ACC, I have our mission and our vision up on the screen for you. Really, our mission is to improve the health and well-being of our region's children through advocacy and strategic investments. Our vision is that hopefully one day, um, the kids in the Appalachian region won't have to travel far from home, out of county, out of state to receive the services that they need. I have a history with ECHO. I was FCFC prior to this role, so I know that there are many kiddos that are being placed outside of their home counties, outside of our home state of Ohio, just to receive the services that they need. And the ACC's hope is that one day we'll have those services in the state of Ohio and in the Appalachian region specifically. So, all of the green counties highlighted are the counties that we serve. We do serve all 32 Appalachian counties. Um, as you can see, the reason we chose Appalachia is because we have a limited access to services and care. A lot of our kiddos are having to travel to Cincinnati, Columbus, Toledo, Cleveland, just to get the services that they need. We have concentrated poverty in this area. 12 of the counties with the highest rates of child poverty are centered in Appalachia, Ohio. We also have that heightened exposure to drugs, and I'm sure you all are aware of this. You are the service providers that are working with these families. These are not unique to Appalachia, but the Appalachia region creates unique barriers that amplify these issues for us. So that is why we chose to really focus on these 32 counties, really looking to limit those barriers for the families, for the children to get access to basic needs, basic healthcare needs. So ACC, we started in March 2020, and really just started as an advocacy group to bring awareness and dollars down to the region to get access to internet, get access to more mental behavioral health workers. In 2022, we started with a behavioral health workforce hub. So we received some funding to really partner with agencies that provide mental and behavioral health to do a three-pronged approach to helping with behavioral health workforce to serve children. The Workforce Hub has grown and changed and no longer exists, but the services still exist. So we don't separate it out anymore. It is just part of the ACC. So we still have our partner agency workforce support. We still have our paid high school internships, which is awesome. And we have then expanded beyond that to include our school health initiative. We have research and data analysis, technical assistance with that, and some research projects, and then my role in prevention. So I'm going to talk very briefly about each one of these. So the first one is the partner agency workforce support. So for agencies that provide mental behavioral health to children and families, because we know children don't grow up in a silo, they have their families there. So although we have children in our name, we do not limit it to only children serving agencies. We have agencies that actually don't serve children, but serve the parents that are partner agencies as well too. So an affiliated organization with us will have access to different supports. They get upskilling fund. So if they have an employee that is interested in furthering their certification or even furthering their education to upskill, they have some limits on that. I don't know the exact number. That has been shifting and changing, but they do have, I believe it's funding for up to 10 employees, depending on the size of the organization. There's a professional development fund. So this is for more trainings, going to conferences, being able to get that paid for through the ACC. Leadership development right now, my colleague Sarah White, who is the director of this section of the ACC, has an ongoing leadership academy that the employees are able to participate in. I know that she has stated that one organization in particular had quite a few new supervisors that hadn't been in a supervisor role previously, so they are taking part in that leadership academy and getting the training and skills to be sustainable employees and supervisors, making sure that they have those skills to lead their team. We also provide free coaching. We don't name it as career coaching, job coaching, life coaching, because it kind of encompasses all of those things. So any employee at our affiliated or partner organizations has access to our free coaching program. It is a 12-week program. They meet one-on-one with a coach and are able to kind of just talk through whatever it is that they need. We do have some support, like I said, for furthering education, for furthering careers. So if that's where the coaching leads, we're able to go ahead and facilitate that as well. Our paid internships and coaching is also available to our youth that participate in this. So we have internship opportunities for high school juniors and seniors. It is a paid opportunity for them. So it's 130 hours at the internship site. This can be at a mental behavioral health agency. We work with the mental behavioral health agency to make sure that they are compliant with HIPAA and confidentiality with possibly someone who is still 17 and underage. So we work with you to go ahead and navigate that whole thing with you. It could also be we've had students that are placed at an Atom board as well too. So working on a more macro level look at the mental behavioral health. We've had youth placed at schools as well too. So they're helping the school counselor and we've had a couple of them actually do some prevention work and going into the younger grades and doing some kind of curriculum with them, second step, some other prevention curriculums with them, and really getting hands-on experience. We have had some behavioral health organizations that are able to work around the confidentiality and have taken some of our youth on ride-alongs, doing home visits as well too. So they were able to figure out the legality of that. If your organization is interested in learning more about that, I can connect you with Anna Reed, who is in charge of our internships. So all of our interns do go through our coaching program. It is part of the requirement of the internship. They get $1,500 after they complete their hours. And if they complete all of their hours and get a good report from their supervisor, there is the possibility of another $500 kind of bonus on top of that as well too. Students can participate in this for up to 4 semesters, so 2 years. They can stay with their same job site if the job site still has supervision available. They can bounce around to different ones. If a senior comes to us and participates in this and then goes to college, we work with them in college as well too. We work with quite a few higher education universities to place their college students as well too, and help with that process. It is still paid for those college students as well, and again, free coaching. The school health initiative. So We received $64 million from the state of Ohio, which is the largest investment from the state into school health. We did not keep almost any of that 64 million. We have partnered with different agencies and different contractors to build these school-based health clinics. Most of them are going to be school-based. We do have a couple that are doing a mobile unit, and then one in particular is kind of our outlier. They are doing a mobile vision clinic as well too. So they're all around some kind of health initiative. We have 16 healthcare partners, as you can see. 34 school districts are receiving this school-based health clinic. Um, we have our first operational clinic. They opened in August 28th of 2024. Um, all of these are in different versions of opening. Some of them were able to repurpose a building or classrooms that weren't being utilized. Some of them are completely building from scratch. So I know that we had a groundbreaking just about a month or two ago in Ross County with Adena Health. So that one is not built yet, but the goal is to have everything built by the end of 2026. So some of them are still kind of a way off from being built, but we're looking at serving over 61,000 students. And these are going to be open to everyone too. So the community, as you can see, the estimated reach on there is 30 or 375,000 people in Appalachia. We're also really working on research and data analysis. So this year we launched our data dashboard. I put a QR code up there so it will, if you scan it with your phone, it'll take you right to our data dashboard. We have over 200 community indicators on health and well-being on there. Includes data for all 32 counties in Appalachia, Ohio. And my favorite part about this is that it's customizable. So if you want to pull data, say on, I don't know, something random, dental health, for your county, you can customize that in there as long as it is in the 32 counties of Appalachia. We do have some data for outside of the Appalachian region, and we are planning on expanding this to the entire state of Ohio. But we had to start with our region first, and then we are going to continue to expand it. We are also working on expanding the community indicators as well. So we have 200 in there. We're working on the next 100 right now. So hopefully we'll have that launched here in the next couple of months. This is completely free. Go ahead and save this QR code, save this data dashboard, use it whenever you want. You do not need to be a partner agency to access this. This is a free resource for everyone to utilize, and it will continue to be updated as we get more information, more data available to us. Prevention, my bread and butter. So this is the work that I've been doing for the last year. The ACC was awarded 1.2 million in federally designated spending. So we have been working in the last year to really uplift and support prevention in the region, and then focusing on some pilot projects to see what the efficacy of those are and if we can replicate those in other regions. So our pilot projects, we have the Map Forward project. This is a project with Albany Counseling Services, which is based in Athens County, to bring the neurosequential model for educators to schools, to give them that basic training, basic skills in that first year of the pilot. If the school then continues to utilize it afterwards, part of the project is to train one of the school staff members in the NME model by Dr. Bruce Perry, so that then they can continue that if they so choose once the pilot is over and we pull out of that. We have three schools that are participating in this. Athens City Schools, Meigs Primary in Meigs County, and oh, I can't remember the name of the third school, but it is in Columbiana County. Garfield Primary is the other school that's participating. Columbiana County is also participating in a different pilot project. They have data that they have taken since 2000, so they participate in a Search Institute survey with their students that they have had since 2000. It lives at their ESC. And so we are paying for a data analytics company to comb through that data and really give Columbiana County a good picture of what the trends have been, if there's anything that they're missing, if there's anything, of course, that reinforces what they're seeing in the community as well, too. And part of that project is making the data more digestible. So part of it was a data storytelling course for 10 community members in the county so that they have the skills to be able to talk about their data and share that in a storytelling way. I think we've all been in meetings where people are sharing data, and it could be really interesting and it can also be really boring. So they wanted to make sure that they had the skills to make it really interesting, and really pull in their community and have those skills again to be able to tell their story. Um, the Oh Yes survey, we're working with OMOS to really spread the amount of schools that are participating in the Oh Yes survey. It is free to the schools to participate in, and it gives such great information about what the trends are in their schools. We also have some youth-led prevention initiatives going. So we have created the Appalachian Youth-Led Prevention Council. We have 5 members. We just launched a couple of weeks ago. So really excited to say that we have 5 high schoolers that are participating in this. We are working in conjunction with Prevention Action Alliance. They have the Ohio Youth-Led Prevention Network and the council, which has historically not had many representatives from Appalachia. They have 2 this year, so we're really excited about that. But we really wanted to amplify the voice of the youth in Appalachia. So creating kind of a feeder program where eventually our kiddos will be able to sit on the OYLPN council, will be able to really amplify and participate in those projects that OYLPN does, like Advocacy Day at the State House and the We Are the Change rally that happens every year. We're also going to be able to provide scholarships to Youth International, which is a youth-led conference that happens in Columbus every year. So we have the opportunity to send not only our 5 kiddos, hopefully more, but also kiddos from other youth-led prevention initiatives throughout the region as well, too. Um, Regional support, we are providing sponsorships to coalitions, prevention coalitions. We have 7 of them, where we're sponsoring some kind of prevention convening. Ross County is the one that is probably furthest along in theirs. We sponsored them last year, saw really good success and survey results from that, so we decided to replicate that. Their event provides CEUs to multiple different designations of certifications. It's like a training day, but we're also kind of leaving it up to the community on what they see. So Scioto and Lawrence County are hosting a youth-led prevention conference. Columbiana County, again, is another one. They're going to do like a family fun day that has prevention organizations there and has a prevention message. So we wanted to be able to provide a sponsorship, but also leave it open to what the community wants and needs. The Child Protection Center of Ross County, I love this because it ties in our Oh Yes survey. So we were contacted because they were looking at their Oh Yes surveys for Pike County specifically, and that children in Pike County were reporting on the Oh Yes survey that they were being inappropriately touched at a higher level than the rest of the state. So they approached us for funding, and we were able to utilize that data and work with our partner agencies. And the Child Protection Center of Ross County is an amazing organization, and they are now providing body safety lessons to all of the schools in Pike County based off of that Oh Yes survey data, which is why we're really trying to amplify the need to participate in that data so that we can get this information and then get those services in place. I spoke really fast, and that was a really, really quick overview of what we are doing. So here is our contact information. There is mine. My direct supervisor is Erin Space. Happy to talk to you all. And then our executive director is Randy Leidy. So feel free to email us any questions. If you have questions about any of the programs that I spoke about, feel free to email me, and then I can get that to the correct department if it's not prevention. I also put another QR code here that leads you straight to our website. I put the website right down at the bottom too, appchildren.org. Real easy.